Hi, it's Christina Weng from Baylor College of Medicine, and I'd like to welcome you to the Retina TLDR, where we tackle the most topical issues in the retina space with leading experts in the field. It's my pleasure to welcome here today my colleague and friend, Dr. Jennifer Murdock, who is an oculofacial cosmetic and reconstructive surgeon practicing in Miami, Florida. As a key opinion leader, Dr. Murdock has a wide range of interests and expertise, including thyroid eye disease, eyelid and orbital reconstruction, and minimally invasive cosmetic injectables. We're delighted she's here today to teach us about the safety of some of these procedures as they pertain to the retina. Welcome, Jenny. Thanks so much for being here today.
Hi, thank you so much for having me, Christina.
Absolutely. It's good to see you again with a beautiful
Always good to
Miami
see you.
backdrop.
I know.
Very jealous.
It's sunny. Sorry.
No, no worries. You're just glowing. It's perfect. So, well, looking forward to learning from you today, but let me first take a moment to explain what inspired this series. So last year I was shocked to learn that the average attention span has shrunk to a mere 47 seconds. So even though I encourage the audience to tune in for the entire conversation, we start every interview with the TLDR. So Jenny, what's your TLDR?
When it comes to the subject of today's conversation, which is going to be pretty much the safety around the eye when it comes to aesthetic injections, my TLDR is anatomy is the most important. And then the second thing is always be prepared.
Love it. Short and sweet. And we're going to unpack that a little bit more today. But I'm sure many people are puzzled as to why we have an oculoplastic surgeon on a retina podcast. But I recently came across an article talking about Ozempic face and how it's fueled a huge rise in the use of facial fillers. And because we as retina specialists have a lot of patients with diabetes and more of them are taking GLP-1 agonists, this is a topic where oculoplastics actually does have a crossroads with retina. So if you don't mind, Dr. Murdock, maybe start off by explaining what people mean by the term Ozempic face. And then just to be clear, it's not unique to Ozempic only. Is that correct?
It's not unique to Ozempic. You're absolutely right. It's really the effects of, I would say, like aggressive use of Ozempic. When used safely and kind of at a steady pace, we don't get what we call it Ozempic face, which is essentially a sudden loss of volume. So when you have so much weight loss in a rapid time period, you lose a lot of not only body fat, but you lose facial fat as well. And so when we say Ozempic face, it's kind of this gaunt Skeletor sort of looking face because of rapid volume loss. Your cheeks start to descend, your jowls can start to descend, you have volume loss, but it also affects your skin as well. You need that healthy fat and collagen to give that firmness and plumpness of your skin. So the skin also looks extra saggy, has poor tissue quality, and it just sort of ages the face and is lacking volume with this rapid weight loss from Ozempic and other GLP-1 agonists.
Yeah, that's a fantastic overview. So to recap, you take these drugs, you have a lot of weight loss, and now are faced with volume loss in the face. And the rise in GLP-1 agonist use, coupled with sort of this growing interest in non-surgical aesthetic treatments, has led many people to turn to facial fillers. In fact, I read that facial fillers are one of the fastest growing procedures in the beauty industry, and that the global market is currently valued at over $5 billion. So if you don't mind, give us a basic primer on the types of fillers out there and how they work.
All right. So your general basic filler, usually when you go into an aesthetic provider and they talk about fillers, what we're generally talking about is hyaluronic acid fillers. Hyaluronic acid is naturally found in our tissues. So we say it's kind of meant to be in the skin and tissues because it is already naturally there. And what it does is replenish volume. So it's essentially a gel with a hyaluronic acid base, and there are different varieties in rheology when it comes to different types of filler. And what it does is it's injected into areas of volume loss. All of them absorb high water content to a certain degree to plump the areas that it is injected into. Now, I'm going to kind of stray off a little bit because biostimulators are kind of like the sister of facial fillers. They're essentially a filler, but in a different way. So while instead of having a hyaluronic acid gel that you get from a package, you might have different things that stimulate your own body's collagen and elastin to either improve skin quality or even to improve volume as well. So we have polylactic acid that is a different type of biostimulator. So PLLA-based treatments like Sculptra, and then we also have Radiesse. There are also different PRP or PRF-based fillers, I guess you can say, that come from your own blood. You take the plasma-rich fibrin or the plasma-rich platelets, and you inject that into your face. And then there's also fat grafting. So there's many different injectable types that can be injected into the face for volume loss. You can consider each one of them a type of filler.
Fantastic overview. Now, I'm sure you know where I'm going with this as a retina specialist, but one of the drawbacks of injecting facial fillers is the risk of retinal or ophthalmic artery occlusion, which is what I understand, a very small but real risk. Have you ever seen this happen? And how do you quantify those risks to patients when you're counseling them?
So I've never seen a retinal artery occlusion. I have seen a vascular occlusion, right? So essentially what happens is that a little piece of this foreign body that we're injecting to the face gets into an artery, and then it ends up basically causing, I call it like a stroke in the face. So when it's in the retinal artery, it's a stroke in the eye. When it's in the eye, it can cause blindness. And there was actually a case presented in Texas a few years ago about an esthetician who injected herself around the eye and
Wow.
ended up getting, choroidal filling defects because it essentially stops the blood flow from getting to the ends of the arteries. So it can be very dangerous, but really the most dangerous areas when people inject are actually around the nose. So if you think about your orbital anatomy and how the arteries around the eyes come out of the orbit and branch into the different areas of their face, a lot of it is really around the nose. So the angular artery around the nose, because that anastomoses into, your retinal system. And then also your supratrochlear and supraorbital nerve that come up and go branch up into the forehead. So when people don't really think about those as being the danger areas, people think about the tear trough, but the tear trough around the inferior orbital rim is essentially an avascular area. So again, this is why I said in the beginning, you have to know your anatomy. The vessels are traditionally around the nose and in the glabellar area. Personally, I don't even inject there. There are very good injectors that will inject around the nose and the glabella, but it is very dangerous. And that's kind of where we see most of our blindness and ocular complications are when people inject in those areas.
Yeah, that's so key because I always heard under the eyes was super dangerous, but not many people talk about the nose and the glabellar area. So those are really the two areas that you have to be especially cautious with. Are there any modifications to the injection technique or any sort of ancillary imaging that can be done to make injections safer?
Yes. So first of all, some people inject with ultrasound. So when you use ultrasound, you can actually clearly see the vessels and locate them because the truth is everyone's anatomy is different. So yes, we know a general idea of where you could see these arteries and other vessels, but an ultrasound lets you pinpoint them specifically. Another technique is to inject deep on bone. So if you're feeling the bone, you're not in a vessel. There's a lot of debate about drawing back and aspirating. Some say that if you get a flash of blood, that definitely means you're in a vessel, but you kind of have to hold it for a good 20 to 30 seconds. And most people are not taking that sort of time when they're injecting. So you could get a false negative, and that's why that one is a little bit controversial. And then lastly, cannula, when you inject with a cannula, it is a blunt tip. So it is less likely to penetrate through an arterial wall. So those are a couple different tricks to keep yourself safe when injecting around the eyes.
Yeah, great. I've read that visual outcomes can be highly variable, but if there is a filler associated retinal artery occlusion that does happen to occur, is there anything that can be done to treat it or to reverse it?
Absolutely. And this is actually my tip number two, be prepared. So everyone who is injecting, no matter where you are, you need to have an emergency kit to kind of do whatever you can to reverse the effects of the vascular occlusion. And again, if you think about it, it's a stroke in the face. So there's a lot of different things that you can do. The first thing, especially if it's a hyaluronic acid filler, you want to dissolve it as best as possible. And some people advocate trying to find the exact vessel that you inject it into and just infiltrating that with hyaluronidase. But really, if you kind of flood the area, that's a great technique. When it comes to the eye and a retinal or choroidal occlusion, we consider, you can consider a retrobulbar block or peribulbar block if that is within your repertoire. You have to be comfortable with it because you can cause way more damage with that sort of injection than reversing the actual problem with the occlusion. Aspirin. So, aspirin is typical when you have a stroke to try to increase blood flow and decrease platelet aggregation. And then also sildenafil. Most of us have, like, I have Dr. Murdock's Viagra in my office to vasodilate, the vessels if there is any sort of occlusion. And the last one, not specifically for the eyes, but maybe the area around the eyes or skin, is nitropid. So again, anything that you can do to vasodilate. As an ophthalmologist, and if it's something in the eye, we kind of treat it like a CRAO. So a central retinal artery occlusion, there's not a whole lot we can do except for, kind of increase the CO2 in the blood. So maybe have them breathe into a paper bag, maybe consider ocular massage. But then last resort, there are certain academic centers that have a protocol set up with interventional radiology. So if needed, in some areas, I think Houston is one of them, you can connect to Methodist Hospital has one there where you can get hyaluronidase injected, through interventional radiology and go straight into the ophthalmic artery. Again, time is of the essence because we don't want to kill the retina, but there are different options, at least to treat it as best as possible.
Yeah, all great examples. Also, back to the point that you made originally, why it's so important to have a trained person injecting your face, because also in these rare instances, they would have that knowledge, as you just shared, to sort of know where to steer you next, and what to kind of do in those situations to optimize outcomes. So I really appreciate that detailed overview. Now, you mentioned this briefly about, I think you call them biostimulators, but really these next generation treatments like PLLA, other collagen stimulators, I hear about Sculptra a lot. Do those carry the same risks as traditional hyaluronic acid fillers?
Yes and no. Okay. So anything you inject around the eye is going to cause risk, right? We even know as ophthalmologists, when we inject Kenalog anywhere around the eye, even the Kenalog particulates can cause vascular occlusion. So in the same way, yes, the Sculptra, Radius, Easy Gel, PRF, PRP, fat for sure can cause artery occlusions. When it comes to kind of Sculptra, there has been a change in the way that they have recommended their dilution so that it's a lot more diluted, which makes it a little bit safer. Because if you think of these tiny little molecular particles swimming around in a diluted volume, it's way less likely to cause any sort of an occlusion. But if you think the more concentrated a product is, the more likely it can cause a vascular occlusion.
Is there anything you're excited about in the pipeline that may help patients experiencing volume loss that may be coming down the pike?
It's interesting because we're kind of shifting back to more natural things to improve our aesthetics. So a lot more PRP, PRF, and fat crafting is sort of coming down the pipeline. Don't know if it's necessarily safer versus traditional filler. But again, anything that you are injecting just needs to be, done safely and with the correct education and knowledge of anatomy. In terms of like new technology, nothing I can think of. Again, we're all trying to be more natural, less synthetic.
Totally. Jenny, this is all so informative. Where can viewers go to learn more about this topic?
That's a great question. So, the American Academy of Ophthalmology actually has excellent written articles called iWiki. So even that can be very helpful. But different providers put on different programs, there's different conferences that provide a lot of different education. And then the companies, Galderma, Allergan, Crown, all of these other different companies are really good at trying to teach safety as best as possible. So if you're a provider and you're thinking about incorporating aesthetics into your program, get in touch with the different reps for those companies and they can set you up with personalized training. They spend a lot of time and energy into making sure that people are trained because as a community, especially as an aesthetic provider community, we all want our patients to be safe. No one wants these complications because it just hurts everybody. So we all kind of come together when it comes to training and education. So there are many, many different resources that you can reach out to learn more about these things.
Fantastic. We'll leave some of those links below with this debut when it comes out. And then last question, unrelated, we've known each other for a long time. So awesome seeing where you've taken your career since your days at Baylor. What's one piece of advice you'd give to someone striving for the professional success that you've achieved?
Oh, great question. Um, I think, at least from my experience, persistence is key. Okay, persistence is key. I'm not one to take no very easily. And I think if done in an eloquent and
True.
professional way, I think it can get you to achieve your goals that you really want. So don't give up, stay persistent, learn from your mistakes, and just keep going forward.
Yeah, that's fantastic advice. Well, super interesting to learn about fillers and what patients need to know about these procedures. Me and my face just might be coming to visit you in Miami one of these days. Hopefully
Your
you have
face
the
is
friends,
beautiful. You don't need
the
anything.
friends and family discount I hope will apply. So thank you so much for joining us today, Jenny. It's great chatting.
Thanks for having me, Christina. Have a great rest of your day in Houston.
Thank you. You as well. Well, we've just kicked off season 2 of the Retina TLDR, and we welcome your feedback. So please reach out via the contact below. In the meantime, I'm your host, Christina Weng, and we'll catch you next time on the Retina TLDR.